to everyone, my partner Luna and me. Now we will talk about some issues related to science problems in our professions, and we will answer some questions. First question, what problem exists in our professions today? In respiratory therapy, one of the main problems is the late detection of respiratory deteriorations. Many patients develop fatigue, hypoxemia, or ventilatory failure before clear clinical signs appear. Another problem is the high workload. Respiratory therapists often manage multiple patients at the same time, especially in the ICU and emerging settings. There is also limited continuous monitoring outside critical care units, in general wards or home care. Patients are not constantly monitored, increasing the risk of sudden complications.
Question 2. What tasks are slow, expensive, or stressful? Continuous monitoring of ventilated patients can be stressful because it requires constant evaluation of ventilator parameters, blood gases, oxygen, therapy adjustments, and clinical assessment. Arterial blood gas analysis is invasive, expensive, and cannot be performed continuously. Manual documentation and repetitive parameters adjustment also increase workload and stress levels.
Question 3. What technology is currently used? What are its limitations? Currently, respiratory therapy use mechanical ventilators, pulse oximeters, capnography, arterial blood gas analysis, incentive spirometers. Limitations. Some equipment is not portable, monitoring outside ICU is limited, blood gases are invasive, devices do not predict early. Deterioration. Main systems do not integrate data automatically.
Question 4. If you could invent anything to solve one problem, what would it be? I would invent a smart wearable respiratory monitoring device that continuously analyzes respiratory patterns and predicts early respiratory failure using artificial intelligence.
Now we will talk about our inventions. Name of the inventions: Smartbreath-pro, AI-based respiratory early warning system.
2. Purpose function. What problem does it solve? Smartbreath-pro detects early respiratory deterioration before the patient becomes critically unstable. It reduces delayed intervention, prevents ICU admission, and decreases complications such as respiratory failure and atelectasis. Who will use it? Respiratory therapy, ICU staff, physicians, hospital monitoring teams, in-home care patients. What is it necessary? Because early detection saves lives, many respiratory complications can be prevented if identified in their initial phase.
3. Physical descriptions. Size: small wearable device similar to a cardiac monitor patch. Shape: thin rectangular patch with soft edge. Materials: medical grade hypoallergenic silicone and lightweight plastic. Colors: white and the light blue to reflect medical safety and clean lines. Portable or devices: completely portable and wireless.
4. What does it look like? It looks like a small chest but connected wirelessly to a smartphone or hospital monitoring system. The mobile app displays respiratory rate, oxygen, saturation trends, fatigue index, risk alert.
5. Price: estimated cost $600 and $900 per unit. It is affordable. Why? Yes, because preventing one ICU admission or mechanical ventilation episode saves thousands of dollars. Long term is reduced hospital costs. Who is it for? Primarily hospital and clinic, but also home care patients with chronic respiratory disease such as COPD.
Seeds. Technology used. Artificial intelligence algorithms, a smart respiratory sensor, Bluetooth and Wi-Fi connectivity, cloud data storage, predictive analytics software, mobile application interface. Thank you for attention. Next, we will show you an illustration of our device.